Hi, everyone, and welcome to the World Doc Allen podcast. I'm excited to welcome to the World Doc Allen. Lindemann, Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. Today's topic, what if my pap smear shows CIN? What is CIN?
Well, it's a pre-cancer, so it has to do with dysplasia. Dysplasia is when there's a little bit of an abnormal growth in the skin, in the skin lining of the cervix. So you have varying degrees of it, and it eventually would wind up being a carcinoma in situ, which would be cancer all the way through the skin, but not underneath the skin.
What stages of CIN can be detected by a pap smear?
Well, we grade that into CIN1, CIN2, and CIN3, which would include almost all the way through and then up to all the way through the skin of the cervix, but not underneath that.
What is active surveillance of CIN?
Well, that's a little bit confusing because it sometimes depends on who's talking about it. There's something also called watchful waiting. But if you're looking at active surveillance, it's an idea that is given to watching something rather than treating it. So, but the problem is that you really need to be careful with it. That is, you need to have periodic visits that the patient can't miss, and periodic pap smears, colposcopies, and HSV, herpes simplex virus testing.
What are the treatment options for CIN? Well,
if it's early, like CIN1, you can certainly look at that and watch it. I think that's a reasonable thing. I read an article on the watchful waiting for CIN2, and the article was interesting because it said the treatment was so successful, they wondered whether it was necessary. And of course, it's hard to imagine the idea that a treatment is so good that you don't want to use it. But that is essentially what the article said. So CIN2 means about halfway through. That is, the dysplasia or the precancerous cells go halfway through the skin.
What's the difference between LEEP procedure and a cone biopsy?
Well, we call that a LEEP. It's a loop electron excision procedure. It's a small heated loop, and that you can really do a small biopsy or you can use a small excision like, say, 3 millimeters in circumference. So, 3 millimeters, that's not even half an inch. It's not even a quarter of an inch. So it's a small amount. A cone is a big procedure, and 45 years ago, we were taught to do a big cone, so the pathologists liked them. The problem with that is that it damaged the cervix. So the LEEP is a more conservative procedure, but it is a good way of treatment.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.